probably late into my high school career. I had been looking at a lot of things. I actually thought about doing some engineering. I loved like the electronics and electrical engineering. I thought about that. I said, I don't know that I can do that. And I had a little part-time job when I was in high school working in a pharmacy. And the gentleman knew my folks and stuff, and it was really a lot of fun. And I said, this is really an interesting thing. That probably started it as well. And I decided I wanted to be a physician. I didn't know at that point about cardiology specifically. It didn't take long for me to find out, as I mentioned about learning the basic science with people. I was fortunate enough to get a summer job with a pharmaceutical company in the suburban Philadelphia area. I thought that was really, really terrific. We were doing some work in biochemistry and some of their medications and things and their compounds. They were trying to develop new drugs. It turns out that my project involved coagulation, blood clotting, things like that. It turns out that what we were looking for is having at that time the recent discovery that heart attacks were caused by blood clots. We were looking for drugs that helped to treat that. We didn't find any, but the interest in blood clotting, blood clots, heart attack was pretty amazing. The small world, or the irony to me, was the pioneer in that was the head of the Department of Medicine at Temple University Hospital. It was such a natural thing for me. I was very excited about the prospect of basically staying there, going to medical school there, staying there to do training. That particular gentleman, and I'm thrilled to say it, signed my certificates, my residency and my fellowship certificates. It was very special to me because that was my interest. And actually I went to medical school saying, I want to do cardiology. I want to put the basic research with people, and I do like people. You know, a good examination. We try to sit across the table again and formulate a plan, which is really, really important. I believe that patients are very much understanding of what, and I'll use the word need to do with them, for them, to them, if they're involved in the plan. It's not, hello, how are you, we'll do some tests, see you later. I like to spend time with family, which is a cliche, but my wife and I do enjoy each other. We have a 22-year-old daughter finishing up at North Carolina State very shortly. We do like the beach, not because we're big water people. We don't have a boat or kayaks. I don't fish. I do play golf, or at least I think I do, or I try to is the better word. I do enjoy it, and it's a nice area. And you know, we have 3 dogs, which we enjoy. They're, you know, an interesting eclectic collection of dogs, and we just kind of enjoy, do a little bit of reading and, you know, laughing. My wife is a nurse, so we do have things very much in common, and that's a nice thing as well.